What is poliomyelitis? Poliomyelitis, commonly known as polio, is a highly infectious viral disease that primarily affects young children but can impact anyone unvaccinated. The virus invades the nervous system, potentially causing muscle weakness, paralysis, or even death in severe cases, often within hours of symptom onset. What is the causative agent? Polio is caused by the poliovirus, a single-stranded RNA virus belonging to the enterovirus genus in the Picornaviridae family. There are 3 serotypes: wild poliovirus types 1 WPV1, 2 WPV2, and 3 WPV3. WPV2 was declared eradicated in 2015 and WPV3 in 2019, leaving WPV1 as the only remaining wild type circulating. What is the route of transmission? The virus spreads primarily through the fecal-oral route, often via contaminated water, food, or poor hygiene practices, for example, inadequate hand washing after using the toilet. It can also transmit through oral contact via respiratory droplets or saliva. The poliovirus multiplies in the intestine and can be shed in feces for up to 6 weeks, even in asymptomatic individuals, making it highly contagious in areas with poor sanitation. When was the first case erupted? Polio has existed for thousands of years, with the earliest known evidence from ancient Egypt around 1400 BCE, depicted in carvings showing individuals with withered limbs and using crutches. The first modern clinical description as a distinct condition was in 1789 by British physician Michael Underwood, who noted debility of the lower extremities in children. Major outbreaks began in the late 19th century in Europe and the United States, with the first large-scale epidemic in the US in 1916. The virus itself was identified in 1908 by Karl Landsteiner and Erwin Popper. What are the signs and symptoms of this disease? Most infections, about 75%, are asymptomatic. In symptomatic cases, minor illness, 24%, flu-like symptoms including fever, sore throat, headache, fatigue, vomiting, and limb pain, resolving in 1 to 2 weeks. Non-paralytic form, 1 to 5%. Aseptic meningitis with neck stiffness, back pain, and sensitivity to light. Paralytic polio, 0.1 to 0.5%. Muscle weakness leading to flaccid paralysis, usually in the legs but sometimes affecting the arms, head, neck, or diaphragm. This can cause difficulty breathing or swallowing, with 2 to 10% of paralytic cases fatal due to respiratory failure. Adults tend to experience more severe symptoms, and survivors may develop post-polio syndrome decades later, involving renewed muscle weakness, pain, and fatigue. How did the world overcome this disease? The global fight against polio began with vaccine development in the mid-20th century. Jonas Salk's inactivated polio vaccine, IPV, was licensed in 1955 after massive trials, followed by Albert Sabin's oral polio vaccine, OPV, in 1962, which was easier to administer and helped block transmission. In 1988, the World Health Assembly launched the Global Polio Eradication Initiative, GPEI, a public-private partnership involving WHO, UNICEF, Rotary International, CDC, and the Bill and Melinda Gates Foundation. Through mass vaccination campaigns, surveillance, and vitamin A supplementation, cases dropped over 99% from an estimated 350,000 inches, 1,988, across 125 countries to just dozens today. Key milestones include polio-free certifications for the Americas, 1,994, Western Pacific, 2000, Europe, 2002, Southeast Asia, 2014, and Africa, 2020. The initiative has prevented over 20 million cases of paralysis and supported broader health efforts. As of December 2025, wild poliovirus persists only in Pakistan and Afghanistan, with ongoing challenges like conflict and vaccine hesitancy, but eradication remains achievable with full implementation of strategies. What is the current treatment? There is no cure for polio. Treatment is supportive and focuses on alleviating symptoms and preventing complications. This includes rest, pain relievers, for example, for headaches or muscle pain, physical therapy to maintain muscle function, orthopedic devices like braces, and mechanical ventilation, for example, iron lungs historically, now modern respirators, if breathing is impaired. Antibiotics may be used for secondary infections, but they do not affect the virus itself. How to prevent this disease? Prevention relies entirely on vaccination, as there are no other effective measures against infection. 2 safe and effective vaccines are used. Inactivated polio vaccine, EPV. 2 to 3 doses provides 99% immunity. Oral polio vaccine, OPV, drops, promotes herd immunity by blocking transmission. 3 doses provide over 95% protection, but carries a rare risk of vaccine-derived poliovirus in under-vaccinated areas. Multiple doses are recommended in childhood, with boosters as needed. Improved sanitation, clean water, and hygiene help reduce transmission risk, but vaccination is essential. Global efforts emphasize routine immunization and supplementary campaigns in high-risk areas.